Well, physiology services, both in clinic and mobile practitioners, have been impacted due to COVID-19. Our next guest trained as a physiotherapist and allied health advocate as well, with a real passion for empowerment through education and training, committed trying to provide access to quality allied health for all people. Jonathan Moody is his name, the founder, CEO of Physio Inc., and joins us now live. Thank you so much for your time.
Great, thanks for having me, Aaron.
So talk to us about what you're seeing at the moment in terms of aged care.
Look, aged care is a really interesting space because obviously the aged care clients that are in aged care facilities or in their own home, they're the highest risk in this COVID-19 crisis, so we have to take the highest amount of precautions. And the really interesting problem is that we need to make sure that these people are seen in their own homes, are seen in the facilities, continue to have the continuation of treatment, because any stalling of their treatment can cause a massive problem down the line for healthcare.
We've spoken to a few people in the disability sector who say that one of the biggest issues with trying to help people in their home and to continue it is both in terms of a lack of staff, but actually also PPE equipment's lacking too, meaning they're going to find it difficult to get in. Is that something that you've seen as well?
Well, PPE equipment was an issue very early on, and then there was a big flood that came in at the same time. As healthcare professionals, we all do try to be organised and try to be prepared. However, there's only so much that you can be prepared in these kinds of things when the supply chain is disrupted. So we got onto it reasonably early, and we did try our best. Early on, we were making sure that people had masks if they needed to for those people most at risk. And but the personal sanitisation measures were the biggest ones that we had to ramp up extraordinarily so.
Talk to us about the state of the aged care industry at the moment. We know there was the Royal Commission into this. You must be looking forward to the findings.
I'm a little bit excited because aged care is something that we do a little bit in terms of in-home care. So we mostly specialise in musculoskeletal in our bricks and mortar stores, as well as we've got a very large disability footprint. Now in aged care, it takes up about 20% of our mobile in-home service. We're wanting to get much more into that, but we seeing that there's a great move to really pushing consumer choice and fee-for-service model, where the consumer gets to decide who comes into their home or who comes into their facility to actually treat them. So hopefully at the end of the Royal Commission, we see that there is a lot more drive towards personal choice and family choice for what is the best services that their family can get, rather than there being a kind of disjointed ACFI model where you kind of make a broad assessment on what they need and then give them massages each week, which unfortunately does happen inside physiotherapy circles with aged care facilities.
Yeah, and certainly when we have a look at the Royal Commission though, I mean, there is a bit of a worry that it could turn out like the Banking Royal Commission, where not much happened. The government under pressure to make an announcement, to have a Royal Commission. We go through the process, we uncover some stuff that's pretty bad practice. But in the end, the Commissioner says, oh, look, a couple of changes here, but the industry itself doesn't change. Do you think that even with the findings of the Royal Commission, there will be actual change within the healthcare industry? I mean, one of the biggest issues, as we know, is trying to retain staff, the pay for staff, the quality of staff, the encouragement of staff as well. And also the privatisation side of things too, where you've got companies that are trying to make a profit. What could possibly change? Like, if you were to come up with the findings of the Royal Commission, what is it, from what we've all heard, that you'd want to actually see?
Yeah, my biggest fear is that the Royal Commission is going to be nothing more than, some talking heads and nothing changes. Now, we've got some massive issues with regards to privatisation of facilities where they become almost too big to fail. And with those too big to fail organisations, they're also trying to vertically integrate their own services. And when you vertically integrate your own services and you have all of your treating practitioners in-house, if you need to do any cutbacks, you can't just cut back on your overheads in terms of your facility costs. You can't just not pay the Office of State Revenue for land tax. You have certain obligations and fixed costs that you have to do. So where do they cut? They cut at the service side of things. So
and that's a good point. What happens, you end up with a casualisation of the workforce, right? You end up with a lot of people who come in, and what that often leads to, and I know a lot of people who work in the aged care, and what they're always saying is, my phone doesn't stop ringing because everyone else keeps calling in sick to go to work. So you end up with a few people who are doing the heavy lifting and then others who aren't, and it becomes quite a toxic culture for a lot of the staff within the aged care facility, which then obviously impacts the people who are there.
Absolutely, and they are working their butts off. And unfortunately, when there's also been this great move to try to gather as many companies together to try to get to economies of scale to try to figure out problems that are probably further up the actual river. And so you've got quite large aged care service providers racing to the bottom on their fee structure, and then trying to figure out how to make it work in terms of paying staff the lowest amount, which usually then causes them to get either new grads or near new grads that aren't fully equipped in terms of their tools and their skills that they have to actually get long-term meaningful change for people that are at the end of life. And so we need to get a more specialised aged care workforce out there, which means that it shouldn't be a race to the bottom in terms of service fees, and we should start to respect that we would all like our parents dealt with the most capable, responsible and well-trained staff, which means that you need to have senior staff, management level staff all involved in the aged care sector rather than just entry level.
And talk to us about the mobile arm of your business. How did that actually come about? Why the need? What does it actually achieve?
It was quite a beautiful story. We had one of our senior receptionists in a bricks and mortar store in Western Sydney whose daughter unfortunately suffered an acquired brain injury when she was quite young. And, one of the best things that we try to do as a company is let people drive their own passions and find their own niche inside health. And so this particular receptionist approached me and said, look, I'd like to start to support people in the NDIS because I see that there is a gap of knowledge there's a gap of quality service, and will you provide me resources? And now I didn't know a hell of a lot about disability at that time. That was back in 2015, 2016, and because I was a very heavily a musculoskeletal physio in terms of sports injuries and low backs and whatnot. Now, what we did is we reached out to our current workforce and we found who had a keen interest and passion in disabilities. They came into this particular receptionist workforce, and we put as much resources as we could behind them to discover how to be excellent, how to have quality service, how to seek out the relevant training. Now that organically grew, and 4 years later we've got in and around 100 allied health staff members that very much have disabilities, their passion, and they're quickly finding out that with regards to aged care, it's a different type of impairment, and the two are very closely aligned.
Yeah, and so now 100 employees in just 4 years?
That's on the mobile side of things. We also have a clinic network of we've got 13 clinics throughout Australia. So, we're kind of coming up to that 200 employees in our network now, and but it still feels and really breathes like a small family business, which is great. It's been wonderful to be able to hold on to that.
Yeah, and just wonderful to see that you're able to kind of thrive during a situation like this, but also to try and come up with a different solution at a time where it's so difficult for a lot of people. And as we know, so many families it's the most terrifying probably decision they have to make about where to put their parents. I always joke with my parents, I'll just be rolling them down a hill, but they're still thankfully a long way from me having to do that at this stage. Jonathan Moody, thanks so much for your time.
Thanks very much for having me, Aaron.